We begin tonight with what may be the most controversial fertility treatment in history. Dr. Michael Kamrava helped Nadya Suleman conceive 6 children. She wanted more. And a procedure he invented resulted in octuplets. Since their delivery, he's been the subject of intense scrutiny. Indeed, officials say it is not the only time he overstepped recommended guidelines with potentially dangerous consequences. And he has not spoken about the so-called Octomom until now. Dan Harris has the report.
It is perhaps the biggest scandal ever to hit the world of in vitro fertilization.
She's already identified herself as a dangerous woman.
She's an unfit mother.
Are these children really safe in their own home?
The so-called Octomom.
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 Nadya Suleman, who gave birth to 8 children last year, becoming a tabloid sensation.
Nadya, tell me this.
While Suleman has given interviews and talked about her doctor,
personally, I don't think he did anything different. He did nothing wrong.
her doctor himself has never spoken about the case until now. He is Dr. Michael Kamrava, a 30-year veteran of IVF, originally from Iran, now roundly condemned by the medical world.
How has this been for you personally?
Well, it's been very traumatic. Quite unexpected.
Looking back at the case of Nadya Suleman, are you confident that you did the right thing?
Well, because of the doctor-patient confidentiality, I can't talk about that.
At first, he says he can't talk about the specifics of the case because Nadya Suleman hasn't given him permission. But then he offers this.
It was done the right way.
It was done the right way.
Yes.
And if you,
under the circumstances.
Under the circumstances.
Yes. Oh my gosh.
The relationship between Dr. Kamrava and Nadya Suleman began years ago. Between 2001 and 2005, Kamrava helped Suleman give birth to 4 children: Elijah, Amara, Joshua, and Aiden, one right after the other.
Without the doctor, I wouldn't have any children. So that's what's so amazing about it.
In 2006, he and Suleman spoke to a local reporter while she was pregnant yet again with twins.
We are trying to help Mother Nature one little push or a little nudge, to make it go the next step.
They were talking about a new technique that Dr. Kamrava had invented, one that has never been clinically tested, which allows him to see inside the patient's uterus as he implants the embryos.
It was amazing. It was it was totally different than the old-fashioned in vitro because you see it through the monitor, you see it on ultrasound, and he knows exactly which area to pinpoint.
In 2008, Suleman came back to Dr. Kamrava's office in Beverly Hills and asked to be impregnated one more time. Despite the fact that she already had 6 children, including new arrivals Caleb and Kalissa, and despite the fact that she was living at her parents' home and using food stamps and student loans to pay the bills, Dr. Kamrava agreed, without, as is common practice, referring his patient for a psychological evaluation.
When a patient has had many children, do you ask for some sort of medical or psychiatric referral?
In general, when we see patients, we don't base our treatments based on patient's appearance or circumstances.
However, what really created controversy is this. Professional guidelines recommend implanting no more than 2 embryos inside a woman under 35, like Suleman. But Dr. Kamrava implanted 6. 2 of those embryos presumably split, making Suleman the Octomom. She became instantly famous, parlaying her notoriety into a source of income, selling access to her family to tabloid outlets like Radar Online.
Octomom does laugh.
Meanwhile, Dr. Kamrava essentially went into hiding as he came under intense scrutiny by the press and by his peers in the medical world.
So in your view, how would you characterize this?
I would say it would be totally irresponsible.
Dr. Roger Lobo is the president-elect of the American Society for Reproductive Medicine. He points out that multiple implantations can be very dangerous.
You can develop complications of pregnancy, from high blood pressure to diabetes to prematurity, bleeding, all sorts of things, cardiovascular risk.
Isn't it also placing the potential babies at risk?
Absolutely.
Dr. Lobo's organization kicked out Dr. Kamrava after holding a conference call with him to hear his explanation for the Octomom case.
Did he say anything in his own defense that was in any way compelling to you?
No.
Nothing.
Nothing.
Go.
As Nadya Suleman brought her octuplets home, the investigation into Dr. Kamrava mounted, and it came out that he was regularly implanting way more embryos than recommended. Dr. John Skadros used to work with Dr. Kamrava.
It's like playing Russian roulette. All it takes is one time, and that's what happened to him, unfortunately, and to Nadya, and to the children.
In our interview, Dr. Kamrava says many doctors ignore the guidelines.
The picture that gets painted of you with these continual implantation of multiple embryos is one that is, to use the words of your colleague, totally irresponsible.
They say 70% of the programs do not adhere to their recommendations. So how do you put me in the same group and the same people criticizing me?
But in that case, is your defense then everybody's doing it?
I'm not defending. I'm saying there are certain situations that need certain attention in each case.
Just today, reports surfaced that the California Medical Board is now saying that just months after Suleman got pregnant with octuplets, Dr. Kamrava implanted 7 embryos into a woman in her late 40s, who later got pregnant with quadruplets, one of whom died.
Given that you had just had a patient who became pregnant with octuplets, what is your view of the fact that you then had a 49-year-old woman who then had quadruplets?
Again, I can't talk specifically about any patients.
Dr. Kamrava insists that legally he has to follow his patients' wishes about what to do with their embryos, although many of his colleagues disagree with that. In our interview, he strongly hints that in the case of Nadya Suleman, he was simply following her wishes.
The patients, legally, they are the owner of the embryos. It belongs to them.
It seems to me that you're saying that when the rubber hits the road, the bottom line is it's the patient's call.
We do have an obligation not to cause harm to the patient, even though sometimes they may be asking for procedures that might be as such. However, as far as the embryos are concerned, we cannot ignore patients' dispositional authority over the embryos.
He now says he has made changes to prevent multiple births in the future. Despite that, Dr. Kamrava is now in danger of losing his medical license. The Medical Board of California has accused him of a pattern of gross negligence.
You've got people out there calling you irresponsible. The word insane was thrown around. What do you want people who have heard nothing but negative press about you to know about you as a physician?
I've been in practicing for 30 years, and I have been of service to the people for 30 years.
While Dr. Kamrava fights to keep his license, Nadya Suleman's octuplets are all now 17 months old, apparently healthy, but also clearly a handful.
It has been traumatic, and it has made a lot of impact, not on me, but also my family.
If you have a low moment, what do you do to buck yourself up?
My wife talks to me a lot and gives me comfort. And I do a lot of walking. Yeah, sometimes bicycling.
Mm-hmm. Does that help?
That helps.
His meeting before the medical board is scheduled for this fall, and he says he is confident he'll be able to convince them to let him stay in business. For Nightline, this is Dan Harris in Los Angeles.